Hi, I'm Dr. Abigail Chaffin. I'm an associate professor of surgery in the Tulane University Division of Plastic Surgery and the medical director at the MedCentris Wound Healing Institute at Tulane. Today I'm going to be talking about a case of a 3-year-old child with multiple joint contractures from pterygium syndrome who underwent an orthopedic contracture release and sustained a postoperative infected wound dehiscence with Pseudomonas. This required multiple debridements by the orthopedic surgeon and left significant soft tissue deficits over the heel and dorsum of the foot with both exposed bone and exposed tendon. She was malnourished and was admitted on IV antibiotics. I had previously placed a bilayered graft on both of these areas to attempt to gain granulation tissue in neodermis. This had failed with repeat exposure of bone and tendon. Here we see the defect debrided and placement of a Myriad graft. The thick configuration was used as an alternative to the bilayered graft in an attempt to create a viable neodermis and soft tissue generation prior to planned split thickness skin grafting. At graft placement, the graft was found to be soft and flexible and conformed well to the wound bed and was immediately seen to uptake the blood components into the graft. The wound was treated with a nonstick dressing, silver alginate, and cast padding wrap. The patient continued as an inpatient in the hospital, was taken back to the operating room in 1 week for a debridement. We could see granulation buds already coming through some of the interstices or the lugging in the Myriad graft. She eventually went on at week 3 to have split thickness skin graft placement over the fully granulated Myriad graft. This is a picture at 1 week postoperative after split thickness skin graft placement, which shows full 100% take of the graft over the dorsal foot wound. At 3 months, she's found to have fully healed wounds with a viable, soft, flexible coverage over the ankle and dorsum of the foot and equivalent movement to pre-op status at the ankle.